Welcome to this tutorial on the cross-sectional anatomy of the parotid gland. Today we are using a software package called Virtual Human Dissector. What we are currently looking at are two windows. On the right of the screen is a 3D representation of our virtual human, and on the left is the cross-sectional anatomy at the level of section indicated by the blue semi-transparent plane. The actual level of cross-section is indicated by the lower blue outline on the side of the head nearest to you. We will use this three-dimensional representation to show the overall anatomy and as a navigation tool. In the cross-sectional view, we can highlight and label the structures of interest. It is important here to remind you of the radiological convention, which is that cross-sections of the body are viewed as from beneath, as if you were standing at the patient's feet. Today we are going to look at the parotid gland, considering its gross morphology, first in 3 dimensions and then in cross-section. Just to remind you about the fundamentals of the anatomy, the parotid gland is the largest of the 3 paired salivary glands, the others being the submandibular and sublingual glands, submandibular and sublingual. About 80% of salivary gland tumours are parotid gland tumours, of which 3/4 are benign pleomorphic adenomas. Benign tumours will not invade the facial nerve, causing facial nerve palsy, but still they must be removed. So in this first part of the tutorial, we will look at the 3-dimensional view of the head, viewed from the lateral aspect. In the 3D view, you can see the parotid gland as a pink mass. It is wedge-shaped, with its superior border at the level of the external auditory meatus, extending beneath the ear and the zygomatic arch onto the external surface of masseter. It extends beneath the angle of the mandible and on to the external surface of sternocleidomastoid, shown here. Simultaneously, we can see the anatomy in cross-section. In this cross-section, the parotid gland has been highlighted in pink, with its duct highlighted in orange. We can see arterial structures as red, venous structures as blue, and nerves as yellow. Muscles are shown in brown, with the mandible being highlighted in white and lymph nodes highlighted in green. The parotid gland is surrounded by a fibrous capsule which is part of the deep cervical fascia. This fascia splits into 2 layers, an outer layer surrounding the outer surface of the gland and an inner layer extending on its inner surface. The fascia is innervated by the great auricular nerve, which you can see here in the 3-dimensional view. Returning to the cross-sectional view, as you look at the parotid duct, highlighted in orange, you can see it extending onto the external surface of masseter, piercing buccinator, and opening opposite the second maxillary molar. Passing through the gland are important neurovascular structures whose anatomy we are about to examine. We are now going to examine the cross-sectional anatomy of the gland at several levels, starting superiorly. This first superior section is close to the upper border of the gland, and here you can see its proximity to the external acoustic meatus cross-sectional view, and again in 3 dimensions. Within the gland, the external carotid artery branches into a maxillary and superficial temporal arteries. The superficial temporal artery is here, though the software package has incorrectly labelled it as the external carotid artery. Its identity can be guessed by turning laterally to see that the superficial temporal vein is close by. If we now move to a more inferior position, we can see the neurovascular structures passing through the gland. In this section we can see the external carotid artery. We can see the superficial temporal vein and also the maxillary vein. Now as we scroll downwards, we can see that these 2 veins will unite to form the retromandibular vein. At this point, the retromandibular vein is superficial to the external carotid artery. It drains into both the internal and external jugular veins and consequently provides one important conduit for infection spread from the inside of the face to the inside of the cranial cavity. Now if we scroll superiorly once more, we are able to see the third structure within the gland, which is the facial nerve. This is superficial to the vascular structures and is passing from the stylomastoid foramen through the gland, which it divides into an anterior and posterior portions, emerging at the anterior border of the gland onto the external surface of masseter. And we can see it here passing close by one of the muscles of facial expression, zygomaticus major. Deep to the gland, you can see the styloid process, and attached to it, the stylopharyngeus muscle. Deep to both those structures is the carotid sheath being outlined now, containing the internal carotid artery, the internal jugular vein, the vagus nerve between them, anterior to the vagus nerve, the glossopharyngeal nerve, and posterior, the spinal accessory nerve. Turning now to the mandible, you can see medial to it and lateral to the medial pterygoid a space. This is the pterygomandibular space containing the inferior alveolar nerve and the lingual nerve. Returning to the venous drainage, we are now going to move inferiorly to see the facial vein. Here. As you will know, there is considerable variation between individuals regarding their venous drainage pattern, and the pattern normally described and shown in this diagram is as follows. If we follow the retromandibular vein and then follow this white arrow, we can see its posterior division joining the external jugular vein. If we return to the retromandibular vein and now follow the yellow arrow, we can see it joining the facial vein and then the two uniting to drain into the internal jugular vein. However, if we return to the cross-sectional view and follow the facial vein, we can see that in this particular individual, as we follow its course, it drains into the retromandibular vein, into the internal jugular vein, directly. Finally, you should observe, shown here in green, and now we scroll back up again, lymph nodes forming the parotid group of lymph nodes in the capsule and external surface of the gland. In this software, the autonomic nerves of the parotid gland are too small to be visible digitally, and so we would describe that autonomic supply by means of a diagram. The parasympathetic secretomotor supply to the gland comes from the lesser petrosal nerve. The lesser petrosal nerve contains axons from the glossopharyngeal nerve, originating via the tympanic plexus, and these synapse in the otic ganglion, lying on the medial aspect of the mandibular division of the trigeminal nerve. The postganglionic axons then reach the gland as branches from the auriculotemporal nerve. An increase in parasympathetic activity to the gland results in an increased production of a watery and enzyme-rich saliva. The sympathetic nerve supply is derived from the thoracolumbar outflow, with the preganglionic axons synapsing in the superior cervical ganglion, which is the most superior ganglion in the sympathetic chain. The postganglionic axons from that ganglion then travel to the gland along the external surface of branches of the external carotid arterial tree in the form of what is known as a periarterial plexus. Increased activity in the sympathetic nervous system in, for example, patients who are nervous in the dentist's chair cause a reduction of saliva production and a thick mucous viscous secretion and a dry mouth. The saliva that the gland produces reaches the oral cavity by passing down the parotid duct. We have already seen it, but just to remind you, coursing across masseter through buccinator and then on to open near the upper second maxillary molar. Let's now return to look at the anatomy of the facial nerve as it passes through the gland. It is very hard in individual cross sections to gain an appreciation of the whole of the nerve. We can see here it's passing through the gland from the stylomastoid foramen onto masseter. But let's turn to a diagram to see the anatomy of the nerve in all its branches. We can see in this diagram that there are 5 groups of branches named from the most superior branch downwards as the temporal, the zygomatic, marginal mandibular, buccal and cervical branches. These nerves have passed through the gland and so are vulnerable to damage either by being cut or simply by being pulled, also known as traction, during the removal of a parotid tumour. Damage to one or more branches of the facial nerve will paralyse the muscles that it innervates. Testing of the branches is carried out as follows. The temporal branch can be tested by asking the patient to lift the skin of the forehead because this nerve innervates the frontalis muscle. The zygomatic branches can be tested by asking the patient to blink because this nerve innervates the muscles of the eye. The buccal branch can be tested by asking the patient to puff out the cheeks because one muscle innervated by the buccal branch is buccinator. The mandibular branch is tested by asking the patient to lower the lower lip. And finally, the cervical branch is tested by asking patients to tense the skin of the neck, as in shaving. In summary then, we have reviewed the anatomy of the parotid gland by looking at the structures that pass through it, and they are the external carotid artery and its branches, the retromandibular vein and its tributaries, the facial nerve and the parotid duct. We have reviewed its autonomic innervation and we have reviewed some of its deep relationships.